Have you ever wondered if something you've considered completely normal for decades could actually be affecting your health differently after the age of 60? It's a question that many men quietly think about, but rarely feel comfortable asking. Today, we're going to have an open, honest, and medically informed conversation about a topic that deserves far more attention than it usually receives: masturbation. While it remains a natural and healthy part of human sexuality throughout life, the truth is that the aging body changes in important ways. And if you continue following the same habits you developed years ago, you could unknowingly increase your risk of discomfort, irritation, or even long-term complications. As a urologist, I've had countless conversations with men who simply wished someone had explained these changes earlier. That's exactly why today's discussion matters. If you're over 60, this isn't just another video about sexual health. It's about understanding how your body evolves with age and learning how to protect it while continuing to enjoy a healthy and satisfying intimate life. Today, I'm going to explain how to masturbate safely after 60, and more importantly, I'll reveal the 3 common mistakes I frequently see men make in my practice. These are mistakes that may seem harmless at first, but over time they can affect your comfort, your confidence, and even your overall well-being. This conversation isn't only about pleasure. It's about supporting your prostate health, protecting delicate tissues, maintaining proper blood flow, and helping you enjoy a fulfilling sexual life for many years ahead. So stay with me until the end, because every point we cover today has the potential to make a meaningful difference. Before we continue, I'd like to remind you that everything discussed in this video is intended for educational purposes only. It should never replace personalized medical advice. Every man's health situation is unique, so if you have concerns or existing medical conditions, always speak directly with your healthcare provider or your urologist before making decisions about your health. Welcome back. Throughout my years working as a urologist, one lesson has become clearer than almost anything else. We cannot truly care for men's health if we avoid talking about the subjects that many people find uncomfortable. Sexual health is an essential part of overall health, regardless of age. Masturbation is a completely normal human behavior, and growing older does not suddenly make it unhealthy or inappropriate. In fact, for many men later in life, it continues to provide several physical and emotional benefits. Research has suggested that regular ejaculation may help promote healthy fluid movement within the prostate and contribute to pelvic comfort, although scientists continue to study exactly how much protection it may or may not provide against prostate disease. The evidence remains mixed, and it's important to be honest about that. At the same time, masturbation can be an excellent way to reduce stress, improve relaxation, and support emotional well-being, especially during periods when partnered intimacy may become less frequent or more challenging. However, this is where many men overlook an important reality. Although the activity itself remains perfectly natural, the body no longer responds exactly the same way it did at 30 or even 50 years old. As we age, our skin gradually becomes thinner and drier. Sensitive tissues lose some of their elasticity. Blood circulation changes, nerve sensitivity may shift, and healing often takes longer than it once did. Because of these natural changes, techniques that once felt perfectly comfortable may now place unnecessary strain on tissues that have become much more delicate over time. That is why today's discussion is not about telling you whether masturbation is good or bad. Instead, it's about helping you understand how to continue this normal part of life in the safest and healthiest way possible. By making a few simple adjustments, you can reduce unnecessary irritation, avoid preventable injuries, and continue supporting your long-term sexual health with confidence. Let's begin with the first mistake I see more often than almost any other, especially among men over the age of 60. Surprisingly, many don't even realize they're making it. The first and perhaps most common mistake is not using enough lubrication, or in some cases, not using any lubrication at all. Many men assume they can continue exactly as they always have, but age changes the body's natural ability to keep tissues properly moisturized. As natural lubrication decreases and the skin becomes drier, friction increases. That extra friction doesn't simply create temporary discomfort. It can also cause tiny microscopic injuries to the sensitive skin of the penis. While these injuries may not always be visible, repeated irritation over months or years can place unnecessary stress on the tissue. In certain situations, repeated tissue injury has even been associated with conditions such as Peyronie's disease, a disorder that may cause painful scar tissue and abnormal curvature of the penis during erections. Although not every man who experiences friction will develop this condition, reducing unnecessary trauma remains one of the simplest ways to protect your long-term sexual health. Fortunately, the solution is both simple and highly effective. Make high-quality lubrication part of your regular routine. Water-based lubricants are an excellent choice because they are gentle on the skin, easy to wash away, and suitable for most men. Silicone-based lubricants are another very good option, especially if your skin feels particularly dry or if you prefer longer sessions since they remain slippery much longer than water-based products. Just remember that silicone lubricants should not be used with silicone intimate devices because they may damage the material. Likewise, oil-based lubricants should never be paired with latex condoms, as they can weaken the latex and reduce its effectiveness. Most importantly, don't be afraid to use a generous amount. If the lubricant begins to dry during the session, simply apply more. There's absolutely no benefit in allowing unnecessary friction to continue. Think of lubrication not as an optional extra, but as one of the simplest ways to protect some of the most delicate tissues in your body, while making the entire experience safer and more comfortable. Now let's continue with the second mistake, and in my experience, this one often goes hand in hand with the first. Even men who remember to use lubrication sometimes continue using techniques that place unnecessary stress on the body. The second major mistake is using excessive force or relying on an overly aggressive technique. Many men develop certain habits during their younger years. At that stage of life, firmer pressure or faster movements may have seemed to create stronger sensations, so those habits naturally became routine. The problem is that our bodies are not static. After the age of 60, the tissues inside the penis become more delicate, blood vessels become more vulnerable, and the nerves responsible for sensation may not tolerate the same amount of pressure they once did. Continuing to use the same level of force can gradually become more harmful than helpful. When too much pressure is applied, or when the penis is bent unnaturally during masturbation, those sensitive erectile tissues can experience unnecessary strain. Tiny blood vessels may become irritated, nerves can be compressed, and the surrounding structures may not recover as quickly as they did decades earlier. While some men dismiss occasional soreness as normal, repeated trauma should never be ignored. Small injuries have a way of adding up over time. I've spoken with patients who believe temporary discomfort was simply part of getting older, when in reality, their technique was contributing to the problem. Some noticed bruising. Others experienced numbness that lasted longer than expected. A few even described a gradual decrease in sensitivity, making intimacy less enjoyable over time. Ironically, using greater force in an attempt to increase pleasure often produces the exact opposite result. Instead of improving sensation, it can actually dull it by placing repeated stress on the nerves that allow you to feel pleasure in the first place. So what should you do instead? The safest approach is surprisingly simple. Slow down. Allow your body to guide the experience rather than trying to force it. Gentle, rhythmic movements are usually far more comfortable and place much less strain on the tissues. Instead of focusing only on reaching orgasm as quickly as possible, pay attention to the sensations themselves. Notice what feels comfortable, what feels natural, and what allows your body to remain relaxed. Remember that sexual pleasure changes with age, and that's completely normal. What felt satisfying in your 40s may no longer be the most enjoyable approach in your 60s or 70s. Rather than seeing this as a limitation, think of it as an opportunity to discover techniques that better match your body's current needs. Being willing to adapt is one of the healthiest decisions you can make. Most importantly, listen carefully to your body's signals. Pain is never something to ignore. Sharp discomfort, persistent soreness, unusual swelling, or any sensation that simply doesn't feel right should be treated as a warning sign. If something hurts, stop immediately. Giving your body time to recover is always better than pushing through discomfort and risking further injury. Now let's move to the third mistake. And this is one that surprises many of my patients because they rarely hear anyone talk about it. Even though it may seem like a small detail, it plays an important role in protecting your health. The third common mistake is neglecting proper hygiene immediately after ejaculation. Many men simply finish, get dressed, and continue with the rest of their day without giving much thought to cleanliness. While that habit may not always lead to problems, it does increase the opportunity for bacteria to multiply, especially as we grow older. Men over 60 are more likely to have medical conditions such as an enlarged prostate or diabetes, both of which can increase the risk of urinary tract infections and other complications. Because of this, good hygiene becomes even more important than it was earlier in life. After ejaculation, residual semen, sweat, and natural skin oils can remain around the genital area. If these fluids are left on the skin for long periods, they may create an environment where bacteria can thrive. This doesn't guarantee an infection, but it certainly increases the possibility of skin irritation, unpleasant odor, inflammation, or urinary discomfort. Fortunately, preventing these issues requires only a few simple habits that take very little time but provide lasting benefits. The good news is that maintaining proper hygiene after masturbation is neither complicated nor time-consuming. A simple routine can make a meaningful difference in protecting your skin and reducing the risk of unnecessary irritation or infection. Once you've finished, gently wash your penis and the surrounding area using warm water. If you prefer using a cleanser, choose one that is fragrance-free, pH-balanced, and specifically designed for sensitive skin. Products containing strong perfumes, alcohol, or harsh chemicals may strip away the skin's natural protective barrier, leaving the area dry and more vulnerable to irritation. After washing, take a clean towel and gently pat the area dry instead of rubbing aggressively. Moisture that remains trapped against the skin can encourage the growth of bacteria or fungi, particularly in warm areas of the body. This small habit may seem insignificant, but over time it helps maintain healthier skin and lowers the chances of developing infections or persistent discomfort. Think of it the same way you think about brushing your teeth or washing your hands. It's a simple act of self-care that protects your health in the long run. Now that we've discussed these three common mistakes, let's step back and look at the bigger picture. Why does all of this become so important after the age of 60? The answer goes far beyond avoiding temporary discomfort. Every healthy choice you make today contributes to preserving your sexual function and overall quality of life in the years ahead. As we grow older, maintaining healthy circulation becomes increasingly important. Good blood flow supports stronger erectile function, nourishes delicate tissues, and helps the body repair itself more effectively. At the same time, healthy nerves are essential for maintaining normal sensation and sexual satisfaction. By reducing unnecessary trauma, preventing repeated irritation, and practicing good hygiene, you're giving your body the best possible chance to continue functioning well for many years. These are not complicated medical treatments. They are simple habits that work together to protect the health you've spent a lifetime building. I often remind my patients that growing older does not mean giving up a satisfying sex life. It simply means becoming more thoughtful about how you care for your body. Just as you may adjust your exercise routine to protect your joints or make changes to your diet for better heart health, your intimate habits deserve the same level of attention. Small adjustments today can help prevent larger problems tomorrow. So let's review a few practical principles that every man should remember. First and most importantly, always listen to your body. Pain, discomfort, unusual swelling, persistent soreness, or changes in sensation are not things you should simply accept as part of aging. Your body communicates through symptoms, and those signals deserve your attention. Ignoring them rarely makes the problem disappear. In many cases, addressing concerns early leads to much better outcomes than waiting until the issue becomes more serious. Second, be willing to explore new approaches. Many men believe they should continue doing things exactly the way they always have, but our bodies naturally change over time. The techniques that once provided the most pleasure may no longer be the ones that feel best today. There's nothing wrong with slowing down, using more lubrication, changing your routine, or focusing more on comfort than speed. In fact, adapting to your body's changing needs is a sign of wisdom, not weakness. Finally, remember that frequency is deeply personal. One of the most common questions I hear is, "Doctor, how often is normal?" The truth is that there is no universal answer. There isn't a medically perfect number that applies to every man. Your overall health, medications, hormone levels, relationship status, stress, sleep quality, and personal preferences all influence what feels right for you. As long as masturbation is comfortable, does not interfere with your daily life, and does not cause pain or injury, the healthiest frequency is simply the one that feels natural and satisfying for your own body. There is no reason to compare yourself with friends, statistics, or stories you may read online. Every man ages differently, and every body has its own rhythm. Instead of focusing on how often you should masturbate, focus on how you feel afterward. If you feel comfortable, relaxed, and free from pain or irritation, that's a much more meaningful indicator than any number. Your goal should never be to meet someone else's expectations. It should always be to support your own health, confidence, and overall well-being. There's one more habit that deserves special attention because it often gets overlooked. Good hygiene isn't only important after ejaculation. It also matters before any sexual activity. Clean hands help reduce the transfer of bacteria to sensitive tissues, lowering the chances of irritation or infection. Likewise, keeping your nails trimmed can help prevent small scratches that may not seem serious at first, but can become uncomfortable or even infected as we age. These are small details, yet together they create a safer and healthier routine. Now, I want to emphasize one point that I consider absolutely non-negotiable. Everything we've discussed today is designed to help you practice safer habits, but none of these recommendations should ever replace professional medical care. Educational information can guide you, but it cannot evaluate your unique medical history, medications, or underlying health conditions. That's why regular checkups with your healthcare provider remain one of the most important parts of protecting your long-term health. If you ever notice persistent pain during or after masturbation, bleeding, unusual discharge, swelling that doesn't improve, significant changes in sensation, or ongoing difficulty achieving or maintaining an erection, don't ignore those symptoms. Likewise, if you discover a new lump, notice a curve that continues to worsen, or experience anything that simply doesn't seem normal for your body, schedule an appointment with your doctor or a urologist as soon as possible. Seeking medical advice early is never something to feel embarrassed about. In fact, early evaluation often allows problems to be identified and treated before they become much more serious. Throughout my career, I've seen many men delay asking for help because they hoped the problem would simply disappear on its own. Unfortunately, waiting rarely improves conditions that require medical attention. Whether it's an infection, an underlying prostate condition, hormonal changes, circulation problems, or another urological issue, early diagnosis usually leads to better treatment options and better long-term outcomes. Your health deserves that level of care. Remember, taking care of your sexual health is no different from taking care of your heart, your joints, or your blood pressure. It is simply another important part of maintaining a healthy body. There should never be shame in asking questions, learning more, or seeking medical guidance when something doesn't feel right. The more informed you are, the better equipped you become to make decisions that protect both your physical and emotional well-being. Gentlemen, masturbation remains a completely normal and healthy part of life, including after the age of 60. Growing older doesn't mean giving up intimacy or sexual satisfaction. It simply means understanding that your body deserves a little more care and attention than it did years ago. By avoiding the common mistakes we've discussed today, using proper lubrication, choosing gentle techniques, maintaining good hygiene, and listening carefully to your body's signals, you're taking practical steps toward protecting your sexual health for the future. Healthy aging isn't about trying to turn back the clock. It's about making smart choices that allow you to continue living comfortably, confidently, and independently. Every small decision you make today contributes to the quality of life you'll enjoy tomorrow. Treat your body with patience, respect, and care, and it will continue serving you far better in the years ahead. If today's discussion helped answer questions you've been wondering about, don't keep this valuable information to yourself. One of the easiest ways to support this channel is by clicking the like button. It lets us know these evidence-based conversations are making a real difference, and it also helps more men discover practical health advice that could improve their quality of life. If you haven't already, be sure to subscribe to Thrive with Dr. Jocelyn and turn on the notification bell. Every week, I share science-backed guidance designed specifically for men over 60, covering topics that are often overlooked but incredibly important for maintaining strength, confidence, and long-term health. My goal is always the same: to provide honest medical education in language that's easy to understand and simple to apply in everyday life. I also encourage you to become part of this community. If you have a question about today's topic or there's another men's health subject you'd like me to discuss, leave a comment below. I read as many of your comments as I can, and your question may even inspire or be answered in an upcoming video. Chances are, if you've been wondering about something, many other men have been asking themselves the very same question. Thank you for spending your time with me today. Choosing to learn more about your health is one of the smartest investments you can make, and I truly appreciate that you've trusted me to be part of that journey. In my next video, we'll explore another topic that many men experience but few openly discuss: low libido after the age of 60. Is a declining sex drive simply a normal part of aging, or could it be a sign that something else is happening inside your body? We'll examine the most common medical and lifestyle causes, separate myths from facts, and discuss practical, natural strategies that may help restore your energy, confidence, and interest in intimacy. It's an important conversation that every man over 60 should hear, so you won't want to miss it. Until then, continue taking care of yourself, stay informed, stay active, and never underestimate the value of small daily habits. They often have the greatest impact on your long-term health. I look forward to seeing you again in the next video.